Let's start off from the very beginning. How does an expectant mother prepare for breastfeeding?
The first thing I usually recommend for my moms is starting probably in the third trimester, maybe a few months before delivery, is to start doing research about breastfeeding to prepare themselves. And a lot of times they can take a class also at the hospital. So if you know which hospital you're going to deliver at, they'll typically offer a class in newborn care and breastfeeding also.
Okay.
So they'll usually have a lactation nurse there or a nurse who's experienced in breastfeeding, and they'll talk about, what to expect for breastfeeding and different positions. Things that will be very beneficial for the mom. Is usually a class that lasts a few hours. But I would do that. You can also do your own research. There's multiple books out there that are very good about breastfeeding. You can use the internet as a good resource. La Leche League is a good website. KellyMom.com is another good website. La Leche League is actually a support group for breastfeeding moms, and they meet periodically. And every city has a group like that, and you can meet with them and talk about problems and just their experiences with breastfeeding.
So the most natural thing in the world actually does not turn out to be so easy as new moms find out, and that's why it's a good idea to read up about it, and as Dr. Mohiuddin says, talk to a nurse, maybe take a class as well. Why should a mother breastfeed her child when formula is so conveniently available? It's there at every grocery store, 7-Eleven, everything. So why should mothers breastfeed?
Well, I think breast milk is more readily available than formula is because you don't even have to go to the store to get it.
Right.
So it's more accessible. So, breast milk, simply put, is just much better for the baby.
Okay.
Than formula is. Even the formula makers recognize that, and they'll say that breast milk is optimal nutrition. But if you're not able to do that, then formulas is the second choice, and they try to mimic breast milk as much as they can with formula.
So what is there in the composition of breast milk that makes it so special?
So there's many things in breast milk that are unique to it. It's a living thing. So it has cells like white blood cells, antibodies, hormones, enzymes, things like that are found in breast milk that help in the growth and development of the baby. So it's a living thing, and it can change with time as well. For example, in a mom has a baby who's born premature, her milk composition is different than a mom whose baby was born full term to meet the needs of the infant. And and the composition can actually change throughout the day. The calories change. So like in formula, the calories are about 20 calories per ounce. Breast milk averages about 22, but it can range from 15 to 30. So it can change during the time of the day. Usually towards the end of the day, it's higher in fat and calories. And even within the actual feeding can change. So the first part of the feeding, which is called the foremilk, is higher in water content and proteins. And the second part, the last part of the feeding, which is called the hindmilk, is higher in fat and calories.
Okay.
So it's almost like the baby has a meal starting off with an appetizer.
How nice.
And then finishes it with a high-calorie dessert.
There you go.
And then falls asleep after that.
Okay. Interesting. And what are the advantages to the infant?
So one of the most studied advantages is decreased rates of infection. So that's probably one of the wider areas of research. They found that babies who are breastfed have decreased rates of ear infections, colds, pneumonia, meningitis, asthma, eczema, multiple. These are just a few things I mentioned, but there's multiple different things.
Okay.
Even sometimes just a little bit of breastfeeding, even for like a month or two, can make a difference.
So when you say rate of infections, is that just in the first year of life or for life?
Well, things like ear infections and colds, it's usually right there in the first part of life. But there's other benefits too, which can be for a lifetime. Like asthma, for example, or eczema. They also found decreased rates of obesity, cholesterol in kids who are breastfed, diabetes.
Okay.
You also see decreased rates of illnesses like Crohn's disease. So multiple different things that you see a benefit in if you breastfeed your baby. And usually the longer you breastfeed, the more benefit you'll see. And typically the recommendation is to breastfeed for a year and exclusively for the first 6 months.
Okay. All right. Why do babies get so many ear infections?
there's a couple of reasons. It's not just one reason.
Okay.
One of the reasons has to just do with the anatomy of the eustachian tube. So they're more prone to getting ear infections because they don't drain the fluid as well.
Okay.
The other thing is babies, their immune systems are not completely developed until they're older. So they're more prone to infections in general. And then a lot of kids are in daycares or they're in schools or they have older siblings who are in school. So they tend to get a lot of colds. And having colds predisposes them to having ear infections as well.
Okay. All right. Good to know, because I had really suffered through that with my kids. It's like every cold turned into an ear infection.
Yes, that's a lot of times that's what happens, because the cold is a risk factor for developing the ear infection. So that's a common thing.
All right. What about advantages to the mother?
So there's benefits to the mom also. If you breastfeed early during that first feeding, right after delivery, there's a hormone that's released called oxytocin and prolactin in the mom.
Okay.
And that helps to actually contract the uterus to minimize bleeding right after delivery. Now, those same hormones, they actually help in feelings of nurturing and bonding between the mom and baby, and also help mom relax. So that's another benefit. It helps mom relax, and there's decreased rates of postpartum depression and anxiety in moms who breastfeed.
Okay.
And then there's also long-term effects, which are beneficial, like weight loss. Helps.
That's a big one.
Yes, yeah, that is a big one. Pregnancy weight loss, which happens over time. There's also decreased rates of breast cancer, ovarian cancer, osteoporosis. And those are seen with more extensive, like breastfeeding. If you've done it for a year or longer, you see those benefits.
Okay. When should a mom start nursing her baby? And is it right after delivery? What about, there are a lot of cultural ideas about colostrum. And so if you can just shed some light on that.
So you mentioned colostrum, and colostrum is that first milk that moms make. It's usually in the first 2 or 3 days before the milk comes in. Usually most moms' milk comes in like day 3 or 4. So that first milk is kind of a thin yellow substance, and it's rich in antibodies, and it's very good for the baby. It also serves as a laxative. It helps the babies to pass meconium. Okay. So we recommend that first feeding as soon as possible if there's no problems with the baby. So within an hour or two of delivery, if you're able to. And the earlier you breastfeed, it's seen as beneficial in helping to establish breastfeeding long term for the baby.
So what if you've had a C-section? Any guidelines for that? Anything you need to avoid, or you can start breastfeeding right away?
You can still start breastfeeding as long as, like I said, there's no problems in the delivery, or your doctor, if there's an issue with a baby or your doctor recommends you have to do something and you're not able to breastfeed, then obviously you should follow the directions for your doctor. But if you're able to, if you can get that first feeding in the first couple of hours, then that's what's optimal. And most hospitals, they actually help you do that. So as soon as you're done with the delivery, they don't take you while you're still in the delivery room. They usually will give you the baby and let you nurse the baby. It won't take the baby away right away, to give you some time there, a few hours to spend with the baby.
But like, for example, if you've had a C-section, you're on all these mega doses of painkillers. Right. So what do you do in that instance?
So you if you're out of it, then you probably won't be able to breastfeed.
Right.
So as soon as you're awake, then you can breastfeed as soon as you're able to.
But don't the painkillers have any that's secreted in breast milk, right?
Some of it can be. It depends on which painkillers you're using. Most of the time they use things like hydrocodone, and which is considered to be moderately safe for a breastfeeding mom, which is the reason why they use things like that. Okay. So there's usually a minimal effect to the baby. Sometimes you may see some drowsiness, but for the most part, it's safe to use for the baby.
And what if you've had twins? Is it still okay? How can you breastfeed then?
You can breastfeed simultaneously, one on each side, or you can that's probably the easiest way, which is most moms I've had who have twins, they've done it that way. They'll breastfeed together, one on each side. And sometimes they do it one after another, but I think the most efficient way is to do them together. Okay.
All right. Let's cover a few questions. So how often should a baby nurse? How long? As in how many minutes? And how do I know if my baby is getting enough?
Well, we know that your baby's getting enough by their weight gain. which is one of the things we're always checking.
And how much how much weight should a baby be gaining, like every day or every week, or what's
in the
guideline?
In the beginning, they usually gain about half an ounce to an ounce a day.
Okay.
Yeah, and typically most newborns, they lose weight after they're born. So that's normal for them to lose weight. And they gain it back in about a week or two. So we're checking that very closely in those first few days of life and those first few visits with the doctor, with the pediatrician. We're checking their weight.
Okay.
So we know by their weight, and we also know by the number of diapers they're making. So those are two of the main things we're looking at. But you can also tell from the baby if they're rooting a lot and seem like they're hungry, then they may not be getting enough milk in.
Okay. How often should a baby nurse?
So in the beginning, you want to breastfeed on demand. So that means whenever the baby's hungry, you feed the baby.
Oh, joyful.
Yeah. So whenever you see signs of hunger, which could be rooting or they're sucking their hands or their thumb, then you want to put them to the breast and nurse them. Generally, it's going to be anywhere from 90 minutes to about 3 hours or so, typically.
The gap.
Yeah, it's going to be somewhere in that range. And over time, they become more efficient, and you'll be on a more regular schedule. But in those first few weeks, it may vary, and it's going to be in that range. Typically, it'll take probably about 20 to 30 minutes for feeding, probably maybe even longer than that. Maybe 20 minutes on each side, probably 20 minutes on each side, 20 to 30 minutes on each side. But the good news is, as the baby gets older, they become more efficient, and the feedings may take only 5 or 10 minutes on each side.
So I was going to say that's one thing that really confuses new moms, because they say, oh yeah, feed the baby every 90 minutes, but it takes an hour to feed the baby. So then do you wait 90 minutes from when you end feeding?
90 minutes from the beginning of the feeding. So if we say, usually like I'll ask my patients, how often are you feeding the baby? So we count it from the beginning of the feeding.
Okay.
So not because sometimes it can take you like 45 minutes for a feeding.
Right.
So from when you started, it'll probably be 2 or 3 hours after that.
Okay.
And the longest you should go in those early stages is 4 hours without a feeding. So you shouldn't go more than 4 hours without nursing the baby. And that's just like in the first month or so. After that, if the baby sleeps longer, then you should consider yourself lucky.
What happens if the baby just keeps falling asleep, does not wake up? I mean, what do you do? Some tips.
Yeah, that's a common problem. A lot of times they'll fall asleep after the first side or after just a few minutes of nursing. So things you can do is to try to stimulate the baby to keep them awake. You can take off their clothes or take off their diaper. Usually they cry and they hate diaper changes.
Right.
So try taking off their diaper or take off their clothes. You can try to stimulate them by rubbing their back or rubbing their feet and try to change their positions while you're feeding. So those things will help. Sometimes even with that, they still fall asleep.
Yeah.
So in that case, you just have to try again. You may have to do the next feeding a little bit more frequently, but that does improve with time.
I remember we used to do something really cruel, and that is take a washcloth and wipe the baby's face, but that was the only thing that would keep them awake.
Yeah, that is sometimes I'll recommend that for parents to do that. So I don't think it's that cruel, but sometimes you have to do it to get the baby to eat, which is more important.
Thank God that they don't remember all the things you did to them, right, when they grow up. All right. Now, how should you supplement with formula? And when is a good time to do that?
So you don't have to supplement unless your doctor says you should, or you really choose, like you need to give formula, or you're not making enough milk. Then you can supplement with formula. But like we talked about, breast milk is ideal nutrition for the baby for the first 6 months of life. So if your milk production is good, you don't need any formula. If you are going to give formula, what I typically tell moms to do is to put the baby to the breast first, give them a few minutes on the breast, 10 or 15 minutes, and then afterwards they can offer like a half an ounce to an ounce of formula. Sometimes I'll do that in the beginning too, when the babies are we talk about weight loss. If the babies are losing too much weight, then I'll have mom start supplementing with formula, and I'll have them do that. I'll have them breastfeed first, and then immediately after they're done to supplement with a little bit of formula to make sure they're getting enough fluids in.
Are there any things that sabotage breastfeeding? Like you often hear about don't give a pacifier or...
Sabotage is a kind of a strong word, but there's things that probably don't help the establishment of breastfeeding. And a pacifier we talked about this last week, but a pacifier is actually helpful for decreasing the rates of SIDS. But that's you should do that later on. Don't do it in the very beginning while you're establishing the breastfeeding. So you don't want to establish or you don't want to give pacifiers or nipples, bottles in the very beginning unless you really have to. If your doctor says they're losing weight or there's some other reason they tell you to supplement with formula, then you should do it. But if you can avoid it and just do only breastfeeding, then that'll help with the nursing.
Okay. Any formulas that you recommend?
Any formula is fine.
Okay.
Similac, Enfamil, Good Start, any of those are fine. They're all FDA approved. Even the store brands like Target or Walmart.
Really?
Any of those are...
The generic ones?
Yeah, generic ones are fine to use.
Okay. All right. Now, when a baby is breastfed, they always say that they need some additional vitamins. What supplements do we need to add to the infant's diet?
In the beginning, all you need is vitamin D. The only thing that's lacking in breast milk is vitamin D and vitamin K. Vitamin K is given to the baby as an injection in the nursery, typically in the first few days of life. So babies don't make vitamin K because it's usually made from bacteria in your gut. So it takes a few months to develop that. So we give it as a supplement then. Vitamin D, there's not much of it found in breast milk, and you get that through sunlight exposure. But we don't like putting babies out in the sun because of the risk of sunburn. So we give vitamin D as a supplement. You do it every day. You can start it, in the first few weeks of life. It's 1 ml a day. It's usually, the dosage usually 400 international units. And you can find that over the counter anywhere. Usually they keep it like in a formula section in most grocery stores.
Okay. All right. Good to know that. And what happens if the mother is sick? You have a cold, you have bronchitis, you put on antibiotics, you need a tooth pulled. I mean, you get put on medication. What do you do? Do you still continue to breastfeed?
In most of those instances, you can still breastfeed. It depends on which antibiotic they're using. Most of them are like penicillins. Most of them are safe to use when you're nursing. But you should check with your doctor if they put you on an antibiotic. You say, is this safe to use? Or you can check with a pediatrician also. But the majority of the time, though, those are not a contraindication, meaning you don't have to stop breastfeeding. So antibiotics, most of them are okay. If you're sick, then that's typically fine too. There's only a few things that you don't want to breastfeed, when I'll get to that in a second. But it actually is helpful to the baby. Like, for example, if you have the flu, your body starts making antibodies to the flu virus as you're getting over the illness. And if you're doing that, then you pass those antibodies through your breast milk to the baby. So the baby gets immunity. It's almost like the baby getting a vaccine. The baby's developing immunity to certain illnesses through your breast milk.
Okay.
So like we talked about, the breast milk, you can pass antibodies from the mom to the baby. And 2, just the breast milk itself, there's lots of things in there that help to fight off infection, like white blood cells and other antibodies like IgA. There's a common one that's found in breast milk that helps to fight off infections.
All right.
It's a common problem. One is you want to make sure that the mom is eating well, healthy diet, and drinking well, and that'll help. Minimizing stress as much as possible will help also. There's an herbal supplement called fenugreek, which is very common, which has been used for years. Yeah, okay. So it comes actually in tablet form. You can buy it at most like vitamin stores, and you can use that, and that helps to stimulate your milk production. So that's something I'll actually recommend for a lot of moms sometimes is try fenugreek and see if that increases your milk production. So that's a good way to do it. Sometimes some moms, they just don't make milk no matter what you do. And those are cases where you have to supplement with formula. So like I said, sometimes that happens and the baby's hungry, they're not getting enough liquids in. You breastfeed as much as you can, and then you give formula afterwards to make sure they're not still hungry. And that way they're still getting the benefit of the breast milk for whatever you're making and however long you're able to do it.
What are some of the things that a mom should eat or not eat? I mean, you mentioned fenugreek, but should, I guess, not eat so that it'll have an effect on the baby through the breast milk.
Right. So you want to avoid things that are gas producing. We talked a lot about colic last week.
Right.
So whatever the mom eats can affect the baby because it's passed through the breast milk. So you want to avoid things that make you uncomfortable. Sometimes it can be things like a lot of dairy products or a lot of beans and lentils and things like that can make you uncomfortable and can make the baby uncomfortable. So
Sorry, go ahead. Go ahead.
So I would avoid those kind of things.
Okay.
As far as what to eat, there's not anything in particular just try to eat healthy and try to make sure you're staying well hydrated.
So when you're talking about hydration, should a new mom drink milk, or what's more important, drinking milk or water?
She can drink both, but more water than milk, because you're not going to drink like 32 ounces. Most moms are not going to drink 32 ounces of milk in a day. So her normal milk intake is fine, but you want to probably increase your water intake.
Okay. How do you store expressed milk, and how long does it stay at room temperature? How long can you keep it in the refrigerator, and how long can you keep it in the freezer? And then can you give frozen milk to the baby?
So you can keep at room temperature. It's good for like 4 to 6 hours typically.
Okay.
If you keep it in a refrigerator, usually it's about 3 to 8 days.
3 to 8 days
in the refrigerator. Yes.
Wow.
So I would say closer to like 3 or 4. 3 to 4 days, maybe a little bit longer if you keep it in the back of the refrigerator. If you're freezing it, then if you keep it in the back of the freezer, it can be anywhere from 3 to 6 months that you can store it. And if you have a deep freezer, then you can do it as long as 6 to 12 months.
Okay.
So you can store it for quite a long time in the freezer.
Okay. And then how do you actually defrost it? I mean, microwave it, or how do you then give it to the child?
You can defrost it by using a bottle warmer or using warm water and putting the milk in the warm water to thaw. And you should never microwave breast milk or formula for that matter, because you can get like hot pockets in there that can scald the baby. And also for breast milk, sometimes you can denature some of the proteins and some of these things we're talking about that are beneficial for the baby. If you're microwaving it, sometimes you're denaturing these things that are beneficial in the breast milk.
Okay, that's a very, very good point. What do you think of sterilizers, and should you be putting bottles in the dishwasher or not? What's a good way to clean these bottles?
Dishwasher is fine. Usually that's enough to clean them. In the beginning, some parents like to sterilize the bottles, which is fine. If you want to boil them, that would be okay. I would if you're going to do that, I would probably just do it in the first couple months of life. And then after that, I think if you're using a dishwasher to clean it with hot water, I think that would be adequate to clean the bottles.
It's funny, with the first baby, you do the sterilization.
You do everything, right? Yeah, you do everything, and then the second one less, and then the next one you do less and less.
Oh, I know.
Yeah, so you don't even have to, maybe the first week or two, if you're worried about a newborn, you may want to sterilize the bottles then. And even the water, if you're making formula, you can sterilize it, but you don't have to do that. You can just use like nursery water or something like that, or even later on you can even just use tap water.
Okay. What about introducing solids? The first solid that we give the baby is rice cereal. And how old is the baby? And should you use formula for that? Or if you're exclusively breastfeeding, do you use breast milk for that?
You can use either one.
Okay.
You can use formula or breast milk. And you just mix it with the formula to make it, or the breast milk to make it kind of like porridge consistency. And I usually have my patients start somewhere between 5 to 6 months. Like we talked about, 6 months is just breast milk is adequate. So typically after 5 months, I'll have them start introducing some rice cereal. And you're doing it basically just to get them used to eating solid foods. They're not getting a whole lot of nutrition from that at that point. But you just give them a few spoonfuls. You can do it once or twice a day in the beginning.
It's just ghastly stuff.
Most babies like it though. They'll eat it.
They'll eat it, and it looks awful, it smells awful, and I'm sure it tastes awful too. So
you can do the rice cereal initially, and then after 6 months, I'll typically start doing the baby food, like the jar foods, like the fruits or the vegetables, the stage 1 if you're buying it. Sometimes parents like to puree it.
What advice do you have for women who need to go back to work and they are breastfeeding? So what are some of the things that they need to do?
So I would start pumping early. Maybe like 4 or 5 weeks before you're going to go back to work. Like we said, you can store breast milk in the freezer for quite a long time. So if your milk production is good and you're making extra milk, that excess milk you can pump and store in the freezer. So that way you'll have plenty to get started when you go back to work. The other thing I would do is I would have someone else start giving the baby bottles. Someone besides the mother, because a lot of times when the mom tries to give the baby a bottle, even if it's breast milk, they don't want to take it.
Right.
So they know the mother's there and they won't take a bottle. So have dad or another relative or babysitter, whoever it may be, start giving some breast milk bottles to the baby a few weeks before you go back to work, so they get used to taking things from a bottle.
Okay.
The other thing I would do is I would discuss with your boss or whoever it is that determines your schedule, and talk to them about your need to pump at work when you go back. And I would try to plan that early, even before the delivery. I would talk to them about it maybe before you leave for your maternity leave, and talk to them about what you know, how often you want to feed, what you think your needs are going to be, and even maybe put it in writing, so that way they know that this is something you've been thinking about, that you're serious about, and you're making a formal proposal for it.
All right, that's a very good point.
And one other thing I just wanted to add to that, that's important for moms going back to work, is, you know, recently in the ACA, the Affordable Care Act, they have a provision in there which allows moms to pump at work. So it says that if this is for companies that have at least 50 or more employees, and these are for salaried employees, that they have to provide them a reasonable amount of time to pump milk, and it should be in a private area that's not a bathroom, away from other people, where they can pump their milk.
Right. That's such a great provision, because when you're nursing your child, the last place you want to do that is a smelly bathroom.
Yeah, that's terrible. No one should have to do that in the bathroom.
Absolutely. And I don't know when restaurants and other businesses will have a little nice little area where a cubicle or something that is totally dedicated to nursing
I think we're a little
mothers.
bit behind in the U.S. as far as supporting breastfeeding moms in work and in public places like that. But you're right. I mean, we're just starting to get some of these kind of laws that help support breastfeeding moms, and hopefully with time these kind of things will improve, where we have these things to improve access. And, you know, if everyone has improved access to breastfeeding and they're able to do it easily, then it's beneficial to us as a society, because the kids, just like we talked about, kids are much healthier when they're breastfed. We talked about obesity is a huge problem in this country, the decreased rates of obesity. One other thing that I forgot to mention is cognition. They've done a lot of studies on kids who are breastfeeding. They do better on IQ tests and standardized tests.
Really?
Yeah, the longer you breastfeed, and they'll see improve rates on those scores, or higher IQ points for the longer the moms breastfeed.
And also, I think cost to society as well. I mean, it's expensive to have your child on formula. I don't remember now what the price is now, but what is the price of a tin of formula?
You know, I don't remember. It's probably about $10 or so, maybe a little bit more. I don't remember, because my babies have always been breastfed, for the most part. So we usually don't use a whole lot of formula.
Right.
But it's not cheap, I'll tell you that much. Yeah. And if you're doing the specialty formulas,
oh my goodness,
like the ones that are made for fussy or gassy babies, or some of the hypoallergenic formulas, those are really expensive.
I think like $20, $25 a can.
Yeah, some of those can be very expensive. So, but that's a great point that you mentioned about cost to society. The cost, and the immediate cost, just from waste, electricity. You don't have to use any electricity when you breastfeed. There's no waste there. You don't have to warm up the breast milk. So those are all things that you have to factor in when you're doing milk, or when you're giving formula. I mean, the other benefits that we don't always think about is the benefits to society by decreasing healthcare costs. There's less time missed by moms missing work. I mean, that's a big cost every time you miss work. So that healthcare costs, kids who are more sick or have more asthma and things like that, obesity. So all these things are setting them up later in life to have all these kind of chronic medical problems. It's a huge cost to, in healthcare and to society in general.
Now, what do you think about this, that if a mother cannot breastfeed, but she can express her milk and give it to the baby exclusively?
Yeah, that's fine. I mean, they're still getting breast milk, and they're getting most of the benefits of breast milk. Okay. So that would be the next best thing if you're able to pump and give milk that way.
Okay, sounds good. What if your little baby doesn't want to wean?
So as far as the timing when you want to wean, it varies according to the mom. Like I said, we want you to breastfeed for at least a year if you can, but after that, it depends on you and it depends on the baby. However long you want to continue nursing for. I have some moms who have breastfed up to age 2. They don't do it a lot, but they may do it a couple times a day. So things that you can do to help is try to start eliminating feedings gradually during the day. And usually I would recommend doing the least important feeding. The most important feeding to the baby is typically the last feeding at night or an early morning feeding. So you may want to remove like a midday feeding in the beginning, and then over time you can slowly remove another feeding until you start weaning off. And then if they're over a year, you can start introducing cow's milk as well, from a cup or sippy cup or whatever, and start doing that. And then obviously at that age, they're taking more table foods as well. So a lot of times babies, they start weaning themselves once they start taking table foods and once you start introducing whole milk. So they may, if they are nursing, they may only be doing it a couple of times a day.
Okay, sounds good. Developmental milestones. What should we look for? And can you shed some light? If you have a preemie, then those milestones are different, right? With respect to a preemie versus a full-term baby.
Yeah, so in regards to preemie, we usually will look for those, we usually correct their gestational age. For example, if they were born like 5 weeks early at 35 weeks, then we'll expect their milestones to be delayed by about 5 weeks. That could be their growth, like height and weight. And also in some other milestones, they may be a little bit delayed in reaching those milestones, and we take those into account. And that's just in the beginning. Usually by the time they're getting close to a year and older than that, they usually start catching up and they're not behind like that. That's just in the first like few months of life for a premature baby. It also depends on how premature they are. But, for a baby who's just a few weeks premature, we'll take that into account as far as monitoring their developmental milestones.
So what about taking a preemie out of the house? What age do you recommend that the preemie can go out of the house?
A lot of premature babies, they're maybe in the hospital for a few weeks. They may be there for a couple of weeks or sometimes even longer, depending on how premature they are. So, it depends on how long they're there. But generally, as a rule for most babies, I usually try to avoid being in public places for the first couple months of life, at least for the first 2 months of life. And the reason for that is, they're prone to infections. Their immune systems are developing so they can catch things easily. Things that may not affect you or an older child could affect the baby and make them sick. So I usually recommend minimizing going out to public places the first couple months. And you can go visit family members, or they can come and visit, provided no one is ill who's handling the baby directly. But generally, the first couple months, I'll just be very careful about going out to public places.
Okay. All right. Beyond the first month, so now your little baby is I think the first week and then the first month is like the hardest time when you have a newborn. And then by the time the child is a month old, things start to sort of settle down. You don't look like hysterically at the baby anymore. Like, what do I do with this little thing? So what should we look at, or what should we look for in terms of developmental milestones?
So the first month or two, you'll see that the baby is starting to pick their head up a little bit more. You'll see that their head control improves. So in the beginning, they can't hold their head up very much. And the first month or two, you'll see improvements in that gradually. The other things you'll see is you'll notice them tracking more. Is you'll see them trying to follow you with their eyes. And by 2 months, you'll see them even like maybe watching you across the room, following you with their eyes. Then they'll start, by 1 to 2 months, you'll notice more sounds. They'll start cooing. Cooing is like vowel sounds that babies start making. And as they get a little bit older, like 4 to 6 months, they start, what we call it, babbling. That's where they make different kinds of like consonant sounds, different, more unique kinds of sounds that they'll make, and they'll be louder a lot of times. If you have a child, you remember them when they start making those kind of sounds. Right.
And smiling, they start smiling like right away in their sleep, right?
They do. Yeah. They start, we call that a spontaneous smile. Means they just kind of randomly do it in the beginning. That's like the first month or so. By the time they're getting close to about 2 months, you start seeing a social smile. And that means they may see mom, or they may see someone else and smile in response to that, or smile in response to something.
Okay.
Yeah, so they're becoming more interactive by that age.
So by about 3 months, the baby should be able to hold its head up.
Usually by about 4 months,
4
they have good
months.
head control, yes.
Okay, so you don't have to support their neck.
Yeah, by about 4 months, you don't have to do that as much.
Okay.
One other thing that's important to help with that is tummy time.
Uh-huh.
So you should start that probably in the first month or two. You
Which they hate.
Yeah, they don't like it in the beginning, and part of the reason is they don't have good head control, so their face is kind of buried in the ground.
Right.
So, but as they improve, or as their head control improves, they'll bear it longer.
Okay.
So, but you should start doing that in the beginning and just give them a few. No, they should always be awake. We talked about this last time. We should never put babies on their tummies to sleep. So this is when they're awake, and you're watching them. So you should put them, in a safe area, lay them out in a blanket, and give them like 10 or 15 minutes on their tummies. And you can do that once or twice a day. And as they're getting older, and their head control improves, you can start increasing that time.
Right. And after that, then when should they be rolling over?
Usually they'll roll one way at 4 months, front to back.
Okay.
And then by 6 months, they can roll both ways, typically, front to back and back to front.
Back to front.
And now those are just kind of average ages. Some babies may start a little bit earlier or a little bit later. So that's not like set in stone. But generally, it's around that age, about 4 months or so, typically, where they start rolling. And by 6 months, they start getting more active, rolling both ways. And that's when you have trouble keeping them in one place.
Okay. What about when does the baby start to sit up and crawl and then finally walk?
So sitting up, they can do with support, even like around 4 months or so. Sitting up without support, it may take up to like 7 to 8 months where they can do it without support. They can sit up on their own. Babies can crawl anywhere from 6 to 9 months, sometimes even a year, up to a year. That's one thing that varies quite a bit. In fact, we have sometimes patients that they never crawl; they just start walking. They skip that whole step. So, but generally, most babies, when they're getting close to somewhere between 6 and 9 months, is when they typically start crawling. Walking is something that can vary also. Generally, the average age is probably about a year or so, but sometimes it's a little bit sooner. Some kids start walking about 10 months. I've seen as early as 9 months where kids start taking a few steps. And sometimes some kids, they don't start walking till 13 or 14 months. And I'm usually not concerned about it unless it's like 15 months and they haven't started walking or haven't started taking a few steps by that age. So there's a wide range. It could be anywhere from 9 to 15 months typically where they start walking, and the average is usually around a year.
One of the best inventions is a boppy pillow. For various...
I wish I invented that.
Yeah, you would be very, very rich. So it is so multi-purpose, and I never had one for my first child, but I had it for my second and third, and oh boy, I was like, where was this when I had my first one? So can you, what we used to do was used to support our child so he or she could sit up. Right? And you would always hear that, oh no, don't do that. It can hurt the child's back, and, you shouldn't be propping up the child to have them sit. What are your thoughts on this?
It depends on the age, because that pillow is not providing a lot of support. So I think if the baby is close to 4 months and they're sitting up and you're using something like that, it's fine. But I wouldn't put a 1-month-old baby in there to sit them up just because they don't have the back control and neck control, and you're not getting enough support from a little pillow like that. They're great for nursing and doing things like that, but I wouldn't use it as something to set them up that early.
Okay. And also, it's a good support for putting the baby on their tummy as well.
Yep.
So, yes, I agree with you. Wonderful invention. What about saying their first word? When should that come in?
Usually it's about a year or so when they start saying their first words. Now, they can usually say mama, dada around 9 months or so. And sometimes they start just saying it randomly, like they're not saying it to you.
Right.
Sometimes we think they are, but they're just kind of randomly saying mama or dada around 9 months or so. But usually their first words typically is usually a year. They can say 1 to 2 words. Usually by 15 months, they can say maybe 5 to 10 words. By 18 months, they may be saying about 20 words. And by 2 years, we expect them to say about 50 words on average. And we expect them to start combining a couple of words together and start understanding like simple or a little bit more complex directions, like 2-part directions. By about a year, 15 months, they should understand simple directions. They should respond to their names. And these are just kind of like we talked about basic guidelines. Everyone's a little bit different. So there's ranges where we consider those to be normal or not normal. And, it may not be exactly at that age, but that's generally what I'm looking for when I'm doing checkups on my patients as far as their milestones as far as speech.
At what age should a child really learn to understand the word no? And having teenagers, I'm still not sure whether they know the meaning of that word.
Maybe at 18, I don't know.
When it's time for them to leave the house, right?
Yeah. So generally, they would probably start understanding at 9 months. Pretty early, they understand no.
Okay.
And sometimes it doesn't even have to be just the word no, but just your look. Or they're very good at picking up cues, like looking at your body language and looking at your face and knowing if you're upset or if you're happy. So they pick up on those things, but they understand that pretty young.
Okay.
Yeah, even before they may start speaking, they'll understand no, or if you're telling them not to do something.
With all the diagnoses of autism happening these days, what are some cues that you should pick up on that all is not right with the child?
Usually after a year or so, like we talked about, that's typically when they're speaking. So if you're not seeing the words that you would expect, like I said, by 15 to 18 months, you're seeing at least 15 to 25 words somewhere in there. So if you're not seeing those words, if you're seeing that they don't seem to be following directions well, or they're not interacting well with other people or with yourself, then that may kind of key you into something may be wrong. And I would go, see your pediatrician. Typically, a lot of pediatricians at the 18-month visit, they do something called the MCHAT test, which is like a developmental test for assessing for signs for autism. So we usually do that about a year and a half, typically, looking for those kind of signs. Just a questionnaire that parents fill out when they come in for that visit.
But before then, the baby is absolutely normal, or will the baby right from the very start have some triggers or some things that you can pick up on?
There may be some things earlier on that you might pick up on, but they may not be as obvious. It becomes more noticeable at this age just because that's typically when we expect babies to start talking more and start interacting, so it becomes more noticeable then. But there may be things earlier on in just the behavior of the baby, like how they interact with you or their smile and things like some of those things we talked about that you may not see them. But those are maybe very subtle signs that you may not notice in the beginning. And they may be very nonspecific and hard to pick up on or to point into one thing or another. But like I said, typically we start checking for these things a little bit later when they're a little bit older and they're talking and it's supposed to be more interactive.
All right. Great information, I think, for any parent for the first 2 years of life, what to look for in your child. Food. I think feeding the child is probably one of the most challenging things, and getting a balanced diet into your child. So let's start off with, we talked a little bit about rice cereal, and then some pediatricians also recommend oatmeal cereal, right?
Yes.
Now, what's your take on all this?
Either way is fine, but there's one thing that I would recommend for either whatever you decide. If you want to do jar foods, that's perfectly fine. And like I said, I typically start about 6 months or so. And you can do I recommend doing one item at a time. Okay. So if you're doing like apples or carrots or whatever it may be, just do that for a few days, like 4 or 5 days. Okay. And we do that just to make sure there's no food allergies. We know the baby is tolerating the food okay. And then if they do okay with that, then you move on to the next item. So if you're making your own food, that's perfectly fine. You can puree your own food and give that as well. But I would follow that same rule is where you try to just do one item at a time. Okay. So I wouldn't give them your mishmash like right off the bat. So that can come a little bit later once they've been on some solid foods for some time, maybe when they're close to about 9 months. Okay. Then you can start adding things in, provided they've had all those ingredients before. So I would do them just one item at a time in the beginning. You can puree it yourself and do it for 4 or 5 days. They do fine to do the next item. And once you've tried a few things, like you've tried, maybe 5, 6 different things, then if you want to do it in a soup or, however you want to do it, then you can do it that way.
All right. When should you introduce egg and when should you introduce fish?
You can introduce, there's not a specific age for eggs or fish. You can introduce it anytime when they start taking table foods.
Okay.
So if they're able to take table foods and they're able to, if you mince up the eggs small enough, then they can have eggs.
Okay.
Anytime after, 6 to 9 months, somewhere in there.
Really?
So whenever they're able to take it, you want to make sure that whatever you're giving them as far as table foods, that it should not be a choking risk. So nothing with large pieces that they can choke on. So if you're giving them fish, you make it in real small pieces and give it to them. If you have a shrimp allergy or some sort of seafood allergy, you probably want to wait on that. You probably don't want to give it that early, just in case it's something that the baby also has.
Okay.
But you can give meat, you can give other chicken, whatever. Just cut it up real small. Make sure they're able to chew those small pieces with whatever teeth they have or the gums that they have.
So when is a good time to introduce some spicy food to the baby, and what would you recommend?
So once you've established table foods and you've tried a variety of table foods, then you can try a little bit of spicy foods. And I'd say somewhere between 9 months to a year. I wouldn't go overboard. So I would do it in moderation, but you can introduce it a little bit when they've started a lot of different table foods. I wouldn't do it very early, like at 6 months, but I would do it when they're a little bit older, close to probably like a year, and they're well established with their diet and the kind of food, what kind of foods they like, and they've tried many different things by then.
Okay. How do you know if your child has food allergies?
Usually you'll see a typical reaction may be a rash. You may see them break out in a rash after taking certain foods. There can be more serious reactions. You've heard of people who have like peanut allergies or shrimp or shellfish, things like that. And they can have what we call an anaphylactic reaction, where they start having trouble breathing, they break out in hives, they can have nausea, vomiting, things like that. But milder reactions are typically, they may have some stomach upset and break out in a rash. So that's typically what you're looking for. And that's, like I said, one of the reasons why we introduce only one food at a time. Because if the child has a problem, then you know what it is. There's no question. If you're giving them a mishmash, then good luck figuring out what it is that they were allergic to.
Okay, so one food at a time. Sleeping. Sleeping battles. Some kids love to sleep and they are like clockwork and love to go to sleep at like 7 or 8 and lucky parents. And some are awake way past midnight. What are some good habits to develop or inculcate in your child? And what do you think of Ferberizing your child?
So as far as good habits, I would try to make a bedtime routine that you stick to every day. You may give the baby a bath or read to them and then put them to sleep at a similar time every single day, and try to put them to sleep in their crib separately without having to rock them to sleep if you can. And that'll help them, help them learn how to fall asleep on their own instead of you holding them all the time.
Okay.
So I would minimize, if they do wake up at night, which we talked about in the beginning, they're going to wake up every 3 to 4 hours. Try to minimize the time that you play with them or interact with them, so you're not stimulating them more. So they kind of get used to knowing that this is nighttime and this is the time I'm supposed to sleep. Leave the lights maybe dim. Don't turn on the lights if you're changing a diaper or you're doing a feeding. So they know that this is the time I'm supposed to sleep. Okay.
All right. And Ferberizing.
So Ferberizing, I think we probably need to clarify what that means. So Ferberizing is named after a pediatrician named Richard Ferber, who wrote a book about sleep training, on how to train kids to go to sleep. And basically his method was, he recommends starting, I think, somewhere after like 2 or 3 months, where you put the baby to sleep in their crib and you progressively increase their waiting time before you console them. And sometimes people call it the crying it out method, even though that's not what he advocates. But basically, you're just increasing the time that they have alone before you come and console them. So you put them in a bed, then you leave them alone for about 5 minutes, let them cry. After 5 minutes, you come back and try to console them without picking them up or without feeding them. And then you progressively increase that time. Then the next time you come in, maybe 10 minutes or maybe 15 minutes. And you slowly try to increase this over time, so the baby learns how to self-soothe and puts himself to sleep on their own. And this method is controversial,
right?
For obvious reasons, because you're letting the baby cry there for some time. But I think there's variations of that method that you can do, and you may do it even when the baby's a little bit older. So I personally have some hesitations about doing this in a very young child or a newborn,
Right.
because the baby expects the parent to fulfill their needs, and if they're crying and you're not picking them up or consoling them, then I think that can have long-term effects on the baby. Like they develop mistrust of the baby, or they think that the parent is not fulfilling their need. So I think that's especially important early on. And if we're talking about toddlers, this is a different story. Yeah.
Right.
But I think in a newborn, you can't spoil a newborn. So when they cry, it's because they need something. So you want to fulfill those needs as a parent, so it helps the bonding process, and they develop trust that they're going to have their needs fulfilled.
I think you said a very, very important point, which is you cannot spoil a newborn. So any amount of love and care and fulfilling the baby's needs that the parents can do, they should be doing in these early few weeks of life. Excellent. And finally, what are your views on swings and bouncers and those jumpy things that are available in the market?
Swings are fine and can be a good way to put a baby to sleep. Bouncers are okay too. The things that we don't like, and most pediatricians or the AAP is against, is those walkers that have the wheels on them. They've actually have tried to ban them from even selling them, because there's just a high rate of injury and accidents from those things, because they may roll up somewhere in the kitchen or spill some hot water on them, or roll down the stairs or something like that. There's any numerous possibilities as far as injuries that the person can suffer. But as far as the stationary bouncers where they jump up or they're just playing with toys or whatever, then those are perfectly fine for a baby to use. And same thing with swings. Swings are something that my kids always really loved and helped them to calm them down and help them fall asleep. And also good in sometimes kids who have spit ups and reflux, and sometimes after feeding you may put them in a swing for a little while.
But can you leave them in there for hours and hours and hours? Any issues with that?
I wouldn't leave them for hours unattended. You can put them in for a few minutes and keep an eye on them. And generally, we recommend, if you're, as far as putting them to sleep, that you don't just leave them in there for hours sleeping.
Okay.
So you can put them in there and help them fall asleep, but after they've fallen asleep, you should take them and move them to their crib and put them in a proper position, like laying on their back in their crib.
Okay, wonderful. And it doesn't, when you have your child in that little gym, stationary gym, or the jumpy thing, it's not going to affect their legs or the development of their bones in their legs or anything like that.
No, not if you're using it appropriately at the proper time. Obviously, you don't want to put like a 2-year-old in those gyms, because they need to be moving around and playing and exploring and being more active. Okay. But if you're using it in an age-appropriate manner, then it's fine to use.
Okay, wonderful. When should you be taking your baby to see the pediatrician when they are sick? Like, does every cold need to be taken to the pediatrician? And what kind of medications are safe to give to the baby?
It depends on, you should look at the whole picture, is what I usually tell my patients is, it's not just a fever. You want to look at how they're acting otherwise. So basically, anytime you're concerned about the baby, you should take them in to see the doctor. If they have a cold and you're not that concerned about it, they're not having fevers and they're eating okay, then you can give it a few days and wait it out and see if they improve. Okay. But if they've gone on close to a week and they're still not getting any better, then I would have them seen. Or if it's earlier and they're not eating well or drinking well, they're not urinating like they should, they're just laying around all day, other things like that, which are indicating a more serious kind of illness, then you should take them in to be seen. Okay. Or if they have high fevers, I generally recommend that they be seen whenever they start that.
Okay. A lot of times, babies tend to develop eczema. So why does that happen, and what should you do for that?
So eczema is kind of it's inflamed, scaly skin. It's a common problem. Even my kids had it. I'm sure you probably experienced it with your kids. Right. It's kind of like a hyper-responsive skin where they react to some sort of irritant and they get inflamed and get very itchy. So the mainstay of treatment for eczema is a good moisturizer that you use every day. It could be something like Cetaphil or CeraVe, Aveeno, Aquaphor. Any of those are fine. Okay. But you have to do it frequently, and you probably want to use a mild soap, something like Dove or something that's hypoallergenic, and use moisturizers as soon as they wash their hands or take a bath, because that really dries out their skin. So even with that, they do have periods of time where they flare up. It's common for eczema. They'll have periods of time where they flare up and get really itchy skin. Stress actually is one thing that makes eczema flare up. And during those times, we usually treat it with steroid creams, which is usually something. Hydrocortisone, which is over the counter, is a steroid cream. It's very mild. Sometimes in mild cases, I'll have parents do that. But for more severe cases, we usually prescribe a steroid cream that they'll use for a few days. We don't use it typically for more than a week at a time. It's only meant for flares usually.
Okay.